Hello, everyone, and welcome to the Masters in Johnson Symposium through the Brown School of Social Work. My name is Ashley Tobeck, and I use she, her, hers pronouns. I am a current Master of Social Work student, a future sexuality educator, and a practicum student at Hope Clinic for Women, which is an abortion care provider in Granite City, Illinois. Today's presentation is called Politicized Abortion Care During COVID-19. It's important to start off knowing that abortion care access is based on your governor's policies, meaning that this is a state dependent decision, not a federal level decision. I also want to mention that when I say abortion care, I am talking about medication abortion and surgical abortion. So, the objectives for today are by the end of this session, participants will be able to understand the current political climate around abortion access in Missouri and Illinois. And by the end of this session, participants will be able to identify what abortion care looks like during the COVID-19 pandemic. Politicians who are anti-abortion are attempting to use COVID-19 as a way to prove that abortion care is non-essential. But we know that non-essential doesn't mean optional or unimportant. So what does this mean for a state to include abortion as non-essential? Imagine how you'd feel if politicians postponed your abortion appointment until the pandemic ends. We are looking at mid to end of 2021, possibly, or even into 2022. And that's what many politicians are doing. They're ignoring the time-sensitive nature of abortion while folks need more access to reproductive health care during a pandemic, not less. Abortion care is nearly inaccessible in Missouri, and in May of 2020, Planned Parenthood was able to get their abortion license back after Governor Parson withheld it from them. Some of the current restrictions on abortion in Missouri that came into effect as of January 1st, 2021 are health plans offered through the Affordable Care Act can only cover abortion in cases of life endangerment. Public funding for abortion is only offered in the case of rape or incest. Administering medication abortion through telehealth is prohibited. And patients must receive state-directed in-person counseling that includes information designed to discourage them from having an abortion. Then, if the person has chosen to get a surgical abortion, they must wait at least 72 hours before the abortion can be performed. When looking at Illinois and their current stance on abortion care, Governor Pritzker announced in April of 2020 that reproductive health care is essential during stay-at-home orders. The statement included, individuals may leave their residence to work for or obtain services through health care. This includes, but is not limited to, hospitals, clinics, pharmacies, public health entities, reproductive health care providers, mental health and substance use providers, and so on. There is also more access for people to get medication abortion pills in Illinois due to the uptake in telehealth. This new and popular access to healthcare is changing the way Illinois is looking at reproductive health during the pandemic. And because of the abortion restrictions in Missouri, people who are pregnant can cross over into Illinois to obtain abortion pills that have been mailed to someone they know or sent to a pharmacy. So the way that Hope Clinic functions as an abortion care provider has changed drastically during COVID-19. Some of the changes are the way we do intakes and instructions now for patients. As you can see in the image on the left, we now provide medication abortion patients with folders that include an informational booklet about the medications we give to them in the clinic and sent with them. We also include additional resources like affirmations and hotlines for partner violence, as well as a pregnancy test with instructions to take a month after the medication abortion. On the right side of the folder, you can see that we have typed out the medication abortion instructions that we go over with the client. The copy shown is sent home with them, and we encourage them to read over it in the next few days that they're having the induced abortion. It's also important to recognize that the individual rooms you see on the slide used to be staff offices, but have all been transformed into patient rooms for counseling. Now the patient educators go through the medical history, questions, needs assessments, and the medication abortion instructions with the client in these rooms. We also make sure to follow COVID guidelines and wipe down every room following an appointment. The signs outside of the doors indicate if the rooms have been cleaned by staff prior to using the room again. So the next steps are to keep fighting for change for reproductive justice in whatever way that means to you. Also, call your state and local representatives to tell them why abortion care is essential during COVID-19 and after. You can also get involved through your local reproductive healthcare clinic as a volunteer or start doing text and phone banks for policy changemakers in your area that support abortion. Thank you, everyone, for taking the time to learn more about what is happening in abortion care access during the pandemic. I hope all of you will go forward and take action to advocate for reproductive health justice.